Pelvic girdle pain is pain coming from the joints, the muscles, the ligaments, and the connective tissue of the pelvis, and it's a very common problem during pregnancy. Women who have pelvic girdle pain can experience pain at the front of the pelvis or at the back or both, and sometimes pain can also refer down the leg. Women who have pelvic girdle pain can feel that a lot of activities are affected, like turning over in bed, getting up from a sitting to standing position, standing on one leg, like going up and down the stairs, or moving the legs apart when getting in and out of a car. So there's a lot of daily activities that can be affected by pelvic girdle pain. The extent to which it affects daily life depends on the severity of the symptoms, and that can vary quite a lot between women. Some women have very mild symptoms and their activities are affected to a very small extent, but for other women it can be very disabling, and they might even need crutches or pelvic belt support to help them walk and do other activities. The pattern of pelvic girdle pain can also vary from more constant symptoms to intermittent or episodic symptoms. So when we try to answer the question, how common is pelvic girdle pain, it's important to look at how do studies that explore that question define pelvic girdle pain in terms of the severity, the pattern, the way they measured pelvic girdle pain, and also whether they looked at pelvic girdle pain at a certain time point in pregnancy or whether they looked at the whole period of pregnancy and any pain experienced in that period. Here in Ireland, we conducted a large cohort study including over 3,000 first-time mothers, and we asked them to fill in on a pain diagram to mark where they're experiencing pain, and then we asked that again after the baby was born. About 2/3 of women said they were experiencing pain during pregnancy in the pelvic girdle area. And 12 months after the birth of their first baby, about 1/3 of those women still experienced some symptoms. The exact cause of pelvic girdle pain is not known, but it seems to be multifactorial. During pregnancy, there are certain factors that impact on pelvic movements and muscle control. For example, the hormonal changes that take place in the body. And also, as the pregnancy progresses, we have a shift of the center of gravity of the body forward. So there is a slight increase in movement in the pelvis, and some women can accommodate that very well, but for others that will lead to strain and pain. This seems to be linked to habitual suboptimal ways of moving and asymmetrical ways of moving. And we can see that women who have a history of any low back or pelvic girdle pain before the pregnancy are more prone to get pelvic girdle pain during pregnancy as well. Pelvic girdle pain can affect daily life in different ways, and it's important to reflect on what pelvic girdle pain means to you. When we look at studies that explore the experiences of women with pelvic girdle pain, they found that sometimes it can be upsetting and frustrating because the symptoms affect daily activities, and it can make women sometimes more dependent on others to carry out these activities. For women who already have children, it can be difficult because it can affect sometimes the activities involved in caring for the children. So it's very important that there's enough information and support to help you manage your pelvic girdle pain. To get more tips and advice on how to assess and manage your pelvic girdle pain, you can have a look at the next 2 videos. The second video is all about reflecting on the triggers of your pelvic girdle pain and give some useful advice on how to adapt and avoid activities that trigger your symptoms. And then in the final video, there are some useful exercises for you to do to help you manage your pelvic girdle pain on a daily basis.